Good evening, everyone. Neosphere Arthritis Foundation is a well known platform, also an NGO, which is an initiative founded by Sri Manoj Krishnan that mainly focuses on not only spreading the awareness of arthritis, but also helping patients and their families deal with the disease in a positive frame. We therefore invite several experts from the medical field to offer their valuable knowledge and expertise with us so that it can benefit everyone. On this episode here today, on Doc Talks episode 12, we have with us Dr. Vinay Aggarwal from Delhi. Dr. Vinay Aggarwal is an expert and has multiple qualifications as an MS in orthopedic, DNB in orthopedic. He has also completed his MRCSED from a college in UK and FRCS in trauma and orthopedics also from Royal College of Surgeons in UK. He holds severe experience as a lead sports doctor of Sports Authority in India, sports medicine doctor at Venture Women India, fellowship in knee arthroplasty, fellowship in hip and knee arthroscopy, and fellowship in shoulder and upper limb pediatric orthopedic from different institutions in UK. He has also received several awards for his work and expertise in various fields of orthopedics and surgery. He has also done several researches and his publications have been put up in different papers for which he has received recognition. Apart from this, he holds memberships in the Pediatrics Orthopedic Society of India, Indian Arthroscopy Society, Indian Orthopedic Association, Indian Medical Association, member East Lancashire Hospitals, National Academy of Medical Sciences, Delhi Orthopedic Association, and Maulana Azad Medical College of Old Students Association. That is an enormous experience, Dr. Vinay Aggarwal. We are extremely grateful to welcome him with us on our show today to deal with different questions on handling surgery in arthritis with Dr. Vinay Aggarwal. Welcome to the show, Doctor.
Thank you. Thank you, Lakshmi.
So that is pretty extensive. Your experience and expertise talks for itself. So, Doctor, thank you for joining us. We would like to know from you today how crucial or challenging it is to perform a surgery on patients with arthritis.
Okay. So let me just begin with arthritis first. So we need to have a deeper understanding of the word arthritis,
True.
which carries a lot of meanings, and it's also a gamut of diseases included in this. So there are various forms of arthritis. One is the most commonly that people understand arthritis as the one which is associated with aging, and that's called osteoarthritis or
Correct.
arthritis of wear and tear. And
Right.
that's because we all have to age. Our joints get aged, and the joints which are more weight bearing, or which the joints which we use a lot, they get aged faster, and
True.
that's osteoarthritis. There are other forms of arthritis which are not because of aging. They are because of some antigen antibody reactions in the body, and
True.
which is partly genetic, partly to do with environments. And there are certain certain things which we still don't know why they happen, but there are other forms of arthritis. So they are
Correct.
grouped under seropositive and seronegative spondyloarthritis, and which includes but not limited to some of the common arthritis like rheumatoid arthritis, ankylosing spondyloarthropathies, then gouty arthritis, psoriatic arthritis. Sometimes skin lesions also have linked with arthritis. So these
Right.
are the various forms of arthritis, and every surgical methodology and surgeries are different for different forms of arthritis.
Right.
So first of all is the diagnosis, which arthritis we are talking about, and what kind of surgery we offer them depends on that kind of arthritis.
Right. So that's pretty much a great insight. So basically, patients with arthritis first need to take their consultation. They need to get deeper into studying what kind of arthritis they have. And depending on the surgery, they need to come back and follow up with experts and definitely follow up on what kind of surgery they need to go about and what precaution needs to be taken. So it's a case on case basis, if I'm to understand correctly.
Yes.
Yes. So, doctor, are there any precautions to be taken by arthritis patients before they undergo a surgery?
Okay. So first, as I said, first is making a diagnosis. Okay. Now, once we have made a diagnosis that what kind of arthritis is it, so if you talk about osteoarthritis, that is arthritis with aging. So there are certain things like certain. We start with simple. simple medications, simple painkiller medications, NSAIDs, and then also advise them a good exercise program depending on the joint affected. Supposedly, patient coming with knee arthritis, they have a specific set of exercises which we advise them. Patient with base of thumb arthritis, they have a specific set of exercises and protocols for them. Similarly, so depending on the joint involvement and the type of arthritis, there are the precautions. People who have people who have arthritis because of antigen antibody reactions like rheumatoid arthritis and all these things, they require first of all understanding of the problem. So first, our first goal is to make our first consultation involves, we spend a lot of time with these patients. First of all, they need to understand that this disease is not going to go. They have to live with it. So it's like a
Right.
neighbor, a nuisance neighbor. When you have a neighbor, you have to adjust that. You have a neighbor and you have to adjust
True,
with them. You
true.
can't change your neighbors. So something of
Agreed.
that sort is with these arthritis. They never go from your body, but at the same time, if you live with them in harmony, just like a troublesome neighbor, if you live with harmony, then you are winning. So first of all, you need to have this understanding that these arthritis, they never go from the body. They are not cure. There's nothing like a cure. They are only remission. We have
Right.
whatever medications we offer, whatever, so even if surgery we do, it's not a cure. It's like, suppose joint is destroyed completely, then the surgery is done. But again, these arthritis are polyjoint. They are polyarthralgic conditions. They involve multiple joints, and all joints can't be replaced or can't be surgically treated. So once you have a harmony of this of with self and understanding of the problem, a good understanding and a good, then obviously medications have a role, and precautions. Generally, precautions they are again case to case specific, but a good amount of exercise program is generally universally advised for almost all forms of arthritis.
That's wonderful, Doctor. Quite a detailed insight and analogy on how to, go about the precautions in surgery before arthritis or with arthritis in patients that way. So we have a question from the audience. How long replace joint work properly? Like in case of arthritis patients here, we are specifically talking about. Also, deformed fingers due to arthritis can they be corrected by surgery? There are two questions here.
All
If
right.
you could,
So the first question, I take it one of the things, the commonly replaced joint is the knee joint. Okay, so when we talk about
right,
the knee joint, and if everything goes well, all the patients the precautions the patients follow well, and everything is goes well, the average life of knee joint is like 20-25 years, and sometimes even
25
more.
years?
Yeah,
Really?
a knee
Even
joint,
in patients with arthritis?
yes, absolutely. A well-done
Wow,
knee
that's
joint
wonderful.
replacement. Yes, a well-done knee replacement. Now, we have a lot of years ahead when the knee joint was first started replacement in India. When in early in late 90s. But now the technology is very good. We have come on to minimal invasive surgeries. We have come on to robotics also now. So
Correct.
good amount of implant, good quality implants are there, and a good a well-done surgery usually lasts much longer. But again, this is not a rule. So there are a lot of factors for that. Patients' body habitus, obese patients obviously have a shorter lifespan of joints.
Right.
Similarly, patients, what kind of activities they do, whether they follow the precautions they are told. And then again, there are certain factors like infections and if they happen, all those sort of things. But as I said, in the best circumstances and if everything goes well, there's a good life of a average knee replacement. But when we
So
talk about
actually,
other
this is
joints,
sorry for interruption. I think this is pretty much positive information that you're giving us or sharing with us today, because what we have understood from our past, whatever we've heard and talked about with other doctors is that average lifespan goes up to a decade or so. But I think with the latest development of robotic surgeries, which also I've heard, even in patients of arthritis, if it is lasting up to a period of 2 decades or more, I think that's pretty much very good, because it kind of most people, encounter such surgeries in their late 60s or early 70s. So it will kind of almost last until their lifetime.
yes, absolutely.
Right.
If you are well aware, if you are if you are a good team with your doctor, as I said, it's a teamwork. It's about understanding, and then the job of a doctor and patient relationship does not get over just after surgery. So there is a prolonged kind of follow up, and if all the precautions, as I said, everything goes well, if all the precautions are followed, patient body habitus is good, patient does not gain a lot of weight, they are not doing all those things which they are not to, which we tell them not to do, then yes, every 2 decades, 2.5 decades is a good lifespan of a knee. But when I come to finger joints, when with the so another question is the fingers. So we see
Correct.
in rheumatoid arthritis, we're also doing finger, elastic implant replacement for finger joints when they get deformed. So they are. Done reserved for cases, first of all, for very deformed fingers, when the when people really have a crooked finger. As I said, this problem is not osteoarthritis. This problem is usually linked to rheumatoid arthritis when you have
Correct.
deformation of finger joints.
Right.
So yes, surgeries are available for correction of the deformities. One of them is elastic implant replacement, elastic prosthesis for finger joint replacement, and also tendon realignment procedures to correct drop fingers and other kind of procedures to correct deformities. But again, the lifespan is not that great for this. So again, it becomes important that the patient selection is very important, that who we choose to. Secondly, the degree of deformity, and also these
Right.
cases are reserved for very deformity, very, when there is a lot of cosmetic concern, a lot of functional concern. And then
Right.
patient has to be aware that there is a you know limited lifespan of these replacement when we talk about finger joint replacements and
So,
finger deformity corrections.
so
So we
limited
prefer fusion
lifespan is
sometimes.
approximately how long can we expect
So
this?
you see, as I said, again, it's case to case basis. These are very reserved procedures. Sometimes, especially in rheumatoid arthritis patient, when there is a deformity, I personally prefer for fusion of certain joints like wrist and certain fingers, if because that carries a lot of longer lifespan and also good function. Elastic implant replacement, finger replacement, again, is very reserved for certain number of cases, and it's very difficult to give exact number of years. But yes, if you carry well, 5 6 years should be okay, or even 10 years. But again, it's again case to case basis.
Again, case to case basis. Yes. So I think this is a lot of great insight on how arthritis patients can go about deciding on their future courses in case they have to undergo surgery. Thank you so much, doctor, for sharing your insights and experience. So there's another question that's coming in from the audience. What are the common complications that we generally see in arthritis patients, particularly during or before surgery?
So you see, when we talk about the seropositive kind of arthritis, where the antigen antibody reactions are involved, like rheumatoid arthritis, gouty arthritis. So these patients are usually immunocompromised. So they are ideally, have been on steroids or have taken steroids in the past. Also, they
True.
have been they have been on some form of immunosuppressants, which lower their immunity. So they are generally not the healthiest of the patients. So again, surgeries, when we plan for these patients, we always take into consideration their metabolic factors, their blood out, everything is okay, their general health is okay. These patients require a lot of care. Sometimes more care than an average patient with osteoarthritis. And
Right.
complications can happen. Complications do happen, but obviously, when you are well prepared, when patient selection is good and facilities are good, and I think complications rate is quite minimized.
It's minimalized. True. I think with the expert doctors and in-depth case studies in coordination with other experts who are or doctors who are handling the case, I think it's a well coordinated effort along with the patient and their cooperation also, which kind of goes a long way into healing the patient or bringing them on the road to recovery. If I'm not wrong.
Yes, absolutely.
Right. So another question that comes in from the audience, we have a very active audience today. So is exercise recommended even after knee transplants?
So, before I answer this question, I would first of all say just one single word, that I am also not, besides an orthopedic surgeon, I am also an exercise medicine doctor or a sports
Correct.
medicine doctor. So, first
Right.
thing I would like to say is exercise is medicine, okay, rather than exercise medicine. So there is almost everything, almost in every aspect of surgery, almost everything, especially when I talk to when I talk about musculoskeletal problems, there is an exercise for almost everything. So yes, definitely there is a role of exercise after knee transplant. Knee replacement basically takes away your pain. It gives you a new joint. But if you do not exercise well, if you do not do the good amount of exercises, then obviously first of all, when the muscles are weak, there will be a lot of load on the knee joint. So ultimately, it's an artificial joint, just as your native joint got burn off. Similarly, an artificial joint itself will get burn off if it's a lot of load. And
Right.
exercises makes your muscle toned. It keeps the muscle ligaments toned. It keeps the joints pulled apart. So definitely there is a role of exercise, and one must exercise whatever the doctors have told according to their condition.
So, in fact, I would say that in a joint replacement, it is not just the bone, but the muscles that keep the joints in place healthier, and that is why exercise is important to build the strength of the muscles, so that
Absolutely.
they can hold the joint for a longer period of time. And obviously, the surgery which has been performed on the patient can last for a longer period, if I'm to
Yeah.
understand correctly. Thank you
Correct.
so much, doctor, for this insight. So we'll My next question to you is, how is the surgery on arthritis patients different from regular patients without arthritis?
So as I said, when we talk about again, when I take this question, I'm considering we are talking about this rheumatoid arthritis and gouty
Right,
arthritis or seropositive kind of arthritis. So
right,
as I said in my earlier, this just before that, these patients are there is a degree of immunocompromise in these patients because either they have been on some immunosuppressant drugs to suppress, because this is antigen antibody based arthritis. Here, the body
right,
has an antigen which is for against which antibody is made against the joint and starts destroying the joint. So these patients are generally, there is a degree of immunocompromised status in these patients. They have been on immunosuppressant drugs, they have been on
correct,
steroids off and on, or some form of drugs. So the immunity is low. So these patients are high risk of infection. So if an infection rate in a knee replacement surgery, if it is 1%, then it will be like 5% or 6% in a immunocompromised patient or a diabetic patient or
correct,
a or an rheumatoid arthritis patient. So we have to be
right.
careful that infection risk is high. So uh, well, standard precaution remain the same, but antibiotic course might be longer. We have to be more careful. It might be the first surgery of the day. These are the simple precautions which we, as a surgeons, we take. Then the chances of
Recovery
periprosthetic
time is
fractures
also longer. Is the
recovery time
recovery
is
time?
longer, yes, because muscles are weaker, muscles have been not been working very well. There is a degree of hypotonia in the muscles because of the disease. Secondly, these patients are also at risk of periprosthetic fractures. When we talk about when we replace their joints, so the bones are very weak in these patients. See, when we do joint replacement, we only replace the joint, but the native bone is
Correct.
the same.
Right,
So the holding of the joint in the bone is also difficult in these patients. So we always use a cemented prosthesis, because nowadays
right,
we have a lot of uncemented prosthesis. But rheumatoid arthritis patients, I always do a cemented knee replacement or a cemented hip replacement, because cement is required to, because the bone quality is poor. It does not hold an uncemented implant, and the
correct,
chances of a periprosthetic fracture, that is a fracture happening after the implantation of the knee of a replacement or replaced prosthesis, is also higher in these patients because the bone quality is poor. So these are the
poor.
general risks we are aware, and though they don't often happen, but there is a tendency to happen. So we should be aware, and patient also has to be aware.
That's wonderful, doctor. I think, with this kind of open communication happens with the doctor before the surgery. So the patient is also well aware of, how far they need to go, what kind of precaution, what surgery or process or procedure they'll be undergoing as part of the surgery. So this kind of insight kind of brings them a new perspective towards leading life and a better quality towards healing, and, supports their family in a big way, I think, both the patients and the families. Thank you so much, doctor. So we have another question coming in from the audience. Is knee replacement done for a 40-year-old, or can knee replacement be done for a 40-year-old arthritis patient?
So thanks for asking this question. Actually, so this question basically touches on another aspect of our current practice, which we are facing a lot
Mhm.
as a sports doctor and also sports person. When I see them, see
Right,
people are now getting very sporty. India is picking up as a fitness thing, and
correct,
also the people are doing a lot of different kind of sports. People mountaineering. Like 20 years down the line, but back, the sports which we never heard of. People are actually coming with their sports. So
right,
yes, people are getting arthritis in their early age. That's the main thing now. And few people, I am seeing a lot of people, lot of youngsters in their 40s, even 35 plus, who develop cartilage damage and they come with arthritis either because of some sports, either because of poor lifestyle or whatever reasons.
right,
Now this is a very difficult thing. Actually, I personally find them the most challenging cases to manage. When it is a person is 55, 60 plus, then choices are easy. We can offer knee replacement easily. But when you are encountering a patient of 40 to 50 years age group, then these choices are difficult, because knee replacement is very difficult to offer. Very, it's not, because as I said, if we take the best case scenario and offer us, considering a lifespan of 25 years for knee replacement, but then 40 65 is just 60 65 years, it will go on. Moreover, the lifespan of our joint also depends on the muscle activity. So if we offer a knee replacement or a joint replacement to a younger patient, the muscles are stronger, they are more active, so the chances of wearing of the joint are higher. So the lifespan of the
right,
joint is shorter. Whereas if
correct,
we do a replacement for a 65 70% plus person, then obviously they are much inactive. The elderly people are lesser active,
right,
lesser muscle bulk, so the replacement lasts longer, because the load on the implant is lesser. So this, I would say, to answer this question, it's a challenging problem. I would say it's not very simple to offer a knee replacement to a 40 to 50-year person. There are other surgeries which have come up, like high tibial osteotomies, half knee replacements, which are also there in the market, available,
Right.
in our setup. So we have
Correct.
to be very very careful when we offer replacement surgery to a young patient. So I
Correct.
would say it's case to case basis, unless it's a dire thing when we have tried almost everything and we can't offer make the patient well, then it would be my last choice to offer a knee replacement to a 40-year-old person. Definitely, I would try to carry them at least to 50 if possible.
All right. Doctor, this leads me to asking you another question. So, can surgery be performed on a patient who has already undergone another surgery or replacement earlier? Like if someone undergoes a surgery at the age of 40, 45, for whatever reason, suppose the reason is very grave and one has to undergo an operation. So, is there a chance that the patient can undergo another operation maybe after 20 years if the bone is again, worn off or whatever? So, can that patient undergo another round of operation? Is that possible for the same joint?
Yes, if considering possibility, yes, it is possible. We do revision knee replacement, revision hip replacement. The possibility is there, and obviously people are now coming back with their burnout implants, whether whatever age they come back, whether 60, 65, 70, and we do offer revision surgeries. So revision surgeries are done, revision implants are available. So possibility is there. But what happens in a revision surgery is that there is a lot of scarring in the tissues. One has already gone
Okay.
under the knife. Okay, the bone
Right.
quality is not great. So obviously, the risks of a revision surgery are always higher than a
True.
first surgery. So the infection rate is higher, the risk of fracture is higher, the scarring is higher. So revision surgery, no surgeon would offer, as a choice. It's a like a it's a compulsion that yes, when nothing is going to be offered, then you would go for revision surgery. And revision can be for various reasons. It can be for
Correct.
infections, it can be for periprosthetic fracture, it can be for that the implant has worn out, the plastic, the main the liner of the joint has worn out. Yes, revision surgeries do happen, but just for the sake of it, like supposedly, as I said, if I start doing knee replacements in younger people, then obviously all of them will end up having revision surgeries by the age they turn up 60, 65. So
True.
it,
True.
it works like that. So we have to be very judicious when we offer surgeries to young patients, especially.
Correct. That's pretty insightful. So yes, obviously, so with the latest development in medical technology, replacement or revisiting surgery or doing the surgery for joints that are already replaced is possible, but then that needs to be considered on a case-to-case basis and only taken as a last resort, if I'm to understand correctly. So, Doctor, we'll take maybe a couple of more questions before we wind up because we're already 22 minutes into our session, and it's been great insight and the in-depth detail that you've given us is very insightful. Thank you so much. So, this question comes here at 56 years with arthritis. Is it advisable to go for cycling or swimming activities? I
So
guess.
swimming is great exercise. Definitely, swimming is there is no way if you can swim. Swimming there is nothing like swimming. In fact, all my sports persons, whenever I do advise any rehab and everything, swimming is absolutely great, fantastic. Because swimming is the lot of buoyant force on the water, and if you can swim very well, then swimming is a great exercise. Cycling is also good, okay, but unless it depends again on your cardiovascular problem. Supposedly you have any heart thing and all, you have to be you must be in confidence with your cardiologist and those sort of things. If you unless you have any medical problem, yes, but I don't think there is any reason for not able to swim or cycle at 56
Right.
or what, even if 66 years of age. There's absolutely no reason. Yes, you should cycle and swim if you can.
Even if it is a patient with arthritis, that's fine.
Absolutely. Yeah.
All right. So, so basically, what you're trying to tell us is that yoga, exercise, any form of light exercise that can keep a person healthy, the muscles stronger and healthy, that will support the joint, is absolutely essential as part of our day-to-day activity, so that
So
a
one
patient
thing I
can
would
be
add
healthy.
on yoga. So one thing when you mentioned yoga, you see yoga is very good, but yoga has a lot of postures and a lot of positions which are not for
Not
everyone.
to be
So
true.
because people have to
It's
be
like
really
kind of
flexible
exercise.
for there are certain poses in yoga, and if you're not in yoga in your youth years, then people sometimes start trying in their 40s and 50s and 60s.
Correct.
So you have to be. I'm not saying no, but then you have to be judicious. So because people sometimes come back to me with injuries while doing all those poses. So yoga
Okay.
is something which has to be judiciously done. You don't stretch out those things which are not. It has to be slow, and also just not like sometimes people start watch YouTube and start doing those poses. But then that person is a trainer. That person is a
Train.
fit person, and you can't just
Correct.
imitate that person at your home. So
Agree.
they have to be. You start slowly and don't overstretch, because sometimes overstretching also can lead to injuries.
Very true. Thank you so much, doctor. So basically, we need an expert in every field. Take consultation with your expert doctors or the doctor in charge, and then go about doing your exercise. Exercise of any form, light, in consultation with your medical practitioner is absolutely essential, is what I understand. So any form of exercise in consultation with your expert doctors, along, coupled with physiotherapy, maybe on a regular basis. Again, taking advice from the doctor is absolutely essential for a good quality lifestyle, if I'm to understand. So, finally, on a leaving note, doctor, we would like to understand what message you would like to give our patients and viewers today.
So, first of all, when the topic is arthritis, so I would say that arthritis is a condition which has multifaceted manifestation. So, first of all, if you have any pain, joint in pain, and any joint problem, first of all, is not making a self-diagnosis and getting it checked up,
Right,
because sometimes you spring up with surprises. Sometimes people crop up with various. It's easier to detect certain things in an early stage and then treat them,
right,
rather than just making a self diagnosis and ignoring it. So first of all is a proper diagnosis of having an arthritis, what kind of
agree,
arthritis we have, taking into confidence with your medical practitioner, an orthopedic surgeon, or whoever you are seeing. And secondly, then coming back to then having arthritis does not mean end of the world. Surgery
right,
is the last thing. First of all, we start with simple medications, simple exercises. Always keep yourself fit, and then there are good surgeries available. There are good techniques available, which almost give you a new leash of life. So depending on the
absolutely.
circumstances, we have all the facilities available. So always, first of all is first step is the making a diagnosis and then taking it
Yes.
further.
So this is one information which we receive from every medical practitioner who are here with us on the show, that please do not do any kind of self-assessment or self-medication. Go, if you are suffering from any basic condition, pain, joint swelling, or anything of that sort, please consult your doctor, get the basic tests done, diagnose the disease, get in consultation with your medical practitioner or expert, and then go about leading a better quality lifestyle to improve your overall health management and lifestyle management. With that note, we thank you very much, Dr. Vinay, for sparing your valuable time with us, and your sharing your expertise, wisdom, and knowledge with all our viewers here today. We thank the audience for being so supportive and actively participating in, putting forth their queries and getting better clarity. And until next time, for many more such shows on Neosphere Arthritis Foundation, we will see you all again. Thank you so much, and have a wonderful evening ahead.
Thank
Thank
you.
you.